So we're going to talk about Medicare. Huge federal program, almost $500 billion a year in expenditures, almost 14% of the federal budget. Huge, complicated program. And oftentimes when I think about it, it can also seem very intimidating to understand. But let's go ahead and sort of take it one step at a time. I'm going to start with this first. Well, why did we develop this program called Medicare in the first place? Well, in the beginning of the 20th century, many presidents, such as Franklin Roosevelt, Harry Truman, were worried that older people and people who were very vulnerable had no access to medical care. Then in 1965, Lyndon Johnson went ahead and started this program, which was really a modification of the Social Security Act. And well, who did he really try to help with this program? Well, he started with people over the age of 65. He felt that they had several specific reasons why they were particularly high risk from serious medical problems. The first was that their incomes were very low. And secondly, because they were older, they had medical expenses that were very high. Because of this condition, almost half of all people over the age of 65 previously had no health insurance at all. And because they had no health insurance, they'd get sick, their savings would be wiped out, be a huge problem for the elderly. So that's the first group of people that Medicare gave health insurance to. The second group was people who were considered to be disabled. These were also individuals that might have very high medical expenses, not a lot of income, and so Medicare for the first time gave a guarantee of health insurance to them as well. And those are the two groups of people that Medicare first started with. As time went on, two other important groups of people were added on. In the 1970s, Medicare started to pay for the care of people who had kidney failure, like dialysis or other major chronic problems with kidneys. And then in the 2000s, also added on people who had a disease called ALS, or Lou Gehrig's disease, which is a disease where you get paralyzed over a long period of time. So we talked about why Medicare was first started and who Medicare covers. And to be clear, it's really these first two groups of people that end up being the lion's share of most of Medicare expenses. But let's try and understand, well, how is Medicare structured and how does it really work? So let's go ahead and start with a patient. Now, this patient has Medicare. And let's say that they need to get medical care. So the first part of Medicare, which is called Medicare Part A, covers any expenses this person might have if they go to a hospital. So if they go to the hospital, they might have to have an extended stay in a patient bed. They'll have nurses that take care of them. They'll have other expenses that come in the acute setting in the hospital. So Medicare Part A ensured that all of those expenses would be paid through this part of Medicare. However, to be clear, it did not cover all of it. People who have Medicare, when hospitals bill them for acute care, still have to pay a $1,000 deductible approximately before any insurance kicks in for the first 60 days of that hospitalization. And after that period of time, they also do have to pay a small portion of the other costs. That's called co-insurance. But it still does offer individuals a way to make sure they don't get completely wiped out. Well, how is this paid for? Well, Part A of Medicare was funded by a 2.9% tax on all Americans, and you had to pay half of that through your own wages, and half of that was paid by your employer, sort of similar to Social Security taxes. And after you paid for that tax for 10 years, you qualified for getting Part A Medicare after you turn 65. Well, you'll notice that there's one group that's not included in Part A, and that is your doctor. They may pay, Part A pays for the hospital part of the expenses, but it doesn't pay for the doctor's expenses. And so that is paid for by the second part of Medicare, which is called Medicare Part B. And so I'll just draw a little line here showing that Medicare also pays doctor's expenses through this Medicare Part B. And I'll draw that as green right here to make sure that you kind of get that that's money. So if your doctor treats you in the hospital, treats you as an outpatient, the doctor submits a separate bill that then gets paid by Medicare Part B. Medicare Part B is a little bit different than Part A. So you actually have to enroll if you're a patient in Medicare Part B, and it's actually, even if after 65, is not free. You have to pay approximately $100 per month as a premium. Whoops, I just made a little mistake, but it's $100 per month. And that actually doesn't get you all the services for free. You still have to pay a deductible, and there is still a copay with that. But by and large, Part B does pay for a lot of the basic aspects of medical care that you may need to get from your doctor. So again, to review, so far we've talked about Medicare Part A and Medicare Part B, which were established as part of that original legislation in 1965. They paid for your hospital and acute care services, and then also paid for doctor services in the hospital or outside. Now you'll notice that we're missing two key things right here. The first is that neither one of these pays for, and I'll draw it right here, this is a bottle right here, for medications. That was not at all part of what Medicare would pay for initially. Some other things were also left out as well, but medications were one of the big expenses people would often have. The other thing you'll notice here is that there is co-insurance, there's deductibles. Even if you have Medicare, there's no protection that those expenses could get completely out of control. That's called not having an out-of-pocket maximum. In other words, even if you had Medicare, you think you're covered, but maybe you have care that costs millions of dollars, there's no maximum amount that you could be charged because you still had to pay a portion of that bill. And that was very difficult for some people as well. Well, later on, as time went on, two other parts of Medicare got added on. And we're going to talk about those. That's called Medicare Part C, going in alphabetical order, as well as, I'm going to draw it here, Part D, and talk about both of those. Medicare Part C began in 1997. And that was a way in which Medicare would actually buy private health insurance for somebody. So in other words, you would say, I don't want Part A and Part B anymore. I'm going to elect to have Medicare just buy me a policy through the Part C program. So they would go to a private insurer like Aetna or Blue Cross Blue Shield, and Medicare would buy you a policy, and then those people, the private health insurers would then pay your doctor, or they might go ahead and pay your hospital. And in return, Medicare went ahead and paid the premium of that health policy to make sure you had it. A lot of people really like this because for the first time, not only did this cover Part A and Part B, but also, if you got a private health insurance plan, sometimes they included prescription medications as well. And they also structured their benefits so that you may not be exposed to a lot of those co-pays, deductibles, and premiums that could lead to very high out-of-pocket expenses. Many people found this very attractive. And today, about 1/4 of all of Medicare's expenses is used to purchase private health insurance through the Part C program. Now, in 2003, yet a fourth part of Medicare was added called Medicare Part D. And so I'm just going to draw this line here. And what this allowed people to do for the first time was this established a comprehensive drug benefit through the Medicare Modernization Act in 2003. And for the first time now, if you wanted to stay on traditional Medicare, not Part C, but Part A and Part B, you also got prescription drugs paid for. This was very popular among seniors, but very controversial because this had no taxes to pay for it. So in other words, this was just added on to the general expenses of the federal government and added a lot of money to the debt. So keep in mind, to review, Part A was paid for because there was a 2.9% general tax for all individuals. On the other hand, Part B right here, as well as Part D right here, are paid for out of general federal revenues. That's a regular expenses added on. So, kind of complicated, but overall you can understand there are Part A, Part B, Part C, and Part D of Medicare that help this patient right here ensure that they get care in hospitals and acute care settings. They also pay the doctor. They could buy you health insurance and also make sure that you get your medications. And this applied to people over the age of 65, the disabled, those with kidney failure, and those with Lou Gehrig's disease. Now I'm going to take a minute and sort of talk about a big issue that many people discuss in Medicare, which is what is going on with Medicare expenses. So I'm going to go ahead and just make a little extra space here and blot this out and draw a little graph of expenses over time so that you can kind of get a sense of, well, what's going on with money in Medicare and why is this an issue for the federal government. So I'm going to draw a graph right here. And when I talk about Medicare expenses, I'm talking about the total cost of Medicare, including Part A, B, and then later Part C and Part D together. So right here I'm going to draw a graph, and this is going to be that total Medicare expenses right there. And then I'll just add total right here to make sure that people know I'm talking about all the parts together. And right here, this is going to be the year. So we're going to start in, say, the 60s right there when Medicare first began, then the 70s, 80s, 90s, and 2000s and beyond. And the way I want to talk about Medicare expenses, talk about the rate of Medicare cost increases. So let's say the cost was exactly the same year after year. That's 0% growth. If the cost is about 5% each year higher, that's 5% growth. And I'll just draw it right here. This will be 10% growth, 15% growth, and then 20% growth. When Medicare first started, people loved it, and as a result, the cost of the amount Medicare was spending was very high. Initially, the annual rate of growth was almost 20% for a while, and then in sometime around the 1980s, that finally got a little bit under control, still above inflation. And then in the 80s, people were pretty happy, but then the expenses started to go up again in the 90s, and then they came down again, and then they went up again, and they've stabilized here. I want to point out one thing on this line, which is really important, which is that even though the costs looked like they were getting better, they still generally were above the rate of inflation, which I could draw right around here. So Medicare was still growing, but just at a slower rate. And the reason I felt this is important to talk about is to sort of get a sense that every now and then the federal government tries to control Medicare costs. In the 1980s, they started a program called the Prospective Payment System, which changed the way hospitals got paid to really try and control the cost of Part A of Medicare. They tried to bundle prices together. They tried to sort of buy in bulk. And that seemed to work for a little while, but then costs went up again. Then in the 1990s, there was another effort called the Balanced Budget Amendment, which also tried to control costs. And that worked for a little while, but again, expenses went up and they've stabilized out. So Medicare is a very complicated program financially. People have made attempts in the past to control costs, but still today, as I mentioned in the beginning, is still about 14% of the federal budget, still $500 billion a year in expenses, a big, complicated, and expensive program.